I'm going to demonstrate essentially a lateral glide mobilization of the radius and ulna. With the Mulligan technique, the comparable sign, we saw that with this mobilization, we saw a decrease in pain with gripping and with wrist extension. So what I have my patient do to make sure that we know that this technique is going to work, I have him gripping an object here. So right now we see that when he squeezes that object, it's reciprocating pain. So we want to do a technique to reduce that pain. So I'm going to use a mobilization belt for these purposes. I have a gait belt because I couldn't find a mobilization belt. Essentially what I'm going to do is put the belt directly distal to the humeral ulnar joint in this case, and with my right hand I am going to push down on the humerus into the mat you can see here. Okay, and what I'm going to do is essentially stand up with the gait belt like this. So I'm pushing down and pulling up. So I'm applying a radial glide. His wrist is, there we go. I'm up by the radial glide. And now what I'm going to have my patient do is go ahead and squeeze the object. And we should see a reduction in pain with gripping. We should also see a reduction of pain with wrist extension. Go ahead and extend the wrist. Good. And we can go ahead and do the mobilizations here. When I'm done with the mobilizations, I'll also know that it has worked if we see a reduction of symptoms immediately following. Here we should have decreased pain with gripping and with wrist extension.